CRPS mystery solved. Mom's harrowing journey of unexplained pain after surgery. Imagine feeling like you're walking on a hotbed of Legos every single day, with the added agony of being stabbed by a pencil. That's the reality Amber Meade faced after a routine ankle surgery. For months, she struggled to understand why her foot pain refused to subside, leaving her unable to work, participate in family activities, or even find comfort in a gentle breeze. But here's where it gets controversial. Chronic regional pain syndrome, CRPS, a condition that can develop after nerve injuries, was the culprit, and it's a diagnosis that many doctors overlook. Amber's journey began with a seemingly straightforward surgery to repair a broken bone in her foot. The procedure went well, but the recovery was anything but smooth. Weeks later, she experienced intense pain that no amount of rest or medication could alleviate. A second surgery revealed that a misplaced screw was pressing on a nerve. But even after correcting this issue, the pain persisted. Her foot would swell up, turn black and blue, and she couldn't bear to put any weight on it. The pain was so severe that even resting under a blanket became unbearable, making sleep a distant dream. Amber's life was upended. She had to leave her job as a surgical assistant because she couldn't stand for long periods. Family activities with her 2 young sons became a distant memory. Even the slightest breeze could trigger her pain, making everyday tasks a challenge. It wasn't until nearly a year later that a doctor suggested she might have CRPS, a condition she had never heard of before. Chronic regional pain syndrome is a complex and often misunderstood condition. Dr. Rohan Jotwani, an interventional pain specialist and anesthesiologist at New York Presbyterian and Weill Cornell Medicine, explains that CRPS can occur after surgeries or other nerve injuries. For some patients, nerve injuries heal over time, but for others, they can develop into a chronic pain disorder. Diagnosing CRPS is challenging because there are no definitive tests or scans. Instead, doctors rely on clinical criteria, such as extreme pain at the injury site, swelling, changes in skin color or texture, and loss of function in the affected area. Treating CRPS is equally challenging. It requires a multifaceted approach that can vary from person to person. Physical therapy is often the first step, but for patients like Amber, traditional exercises were impossible due to the intense pain. Medications to reduce nerve signals and interventional techniques like nerve blocks are also options, but they may not provide lasting relief. In 2022, Amber's pain finally led her to Dr. Anita Davis, a physical therapist specializing in CRPS at Brooks Rehabilitation in Florida. Davis developed a customized physical therapy routine that focused on both physical and emotional aspects of pain management. They incorporated relaxation techniques and exercises to help Amber cope with the mental toll of constant pain. While CRPS is a lifelong condition with no cure, Amber's treatment plan led to some improvements. She can now focus on her daily activities, sleep better, and even enjoy walking on the beach, one of her favorite pastimes. Amber's journey is a testament to the importance of persistence and the right treatment approach. She still experiences pain and discomfort, but she's made significant progress. She receives ketamine infusions every few months, which combined with physical therapy allows her to do more than she could before her diagnosis. The effects of the infusions last about 4 weeks, during which she focuses on strengthening her body. Even without the infusions, Amber is dealing with less pain than before and can participate in more activities with her family. Amber's story raises important questions about the recognition and treatment of chronic regional pain syndrome. How many other patients are suffering from undiagnosed CRPS? What more can be done to improve diagnosis and treatment options? As Amber continues her journey towards a less painful future, she remains hopeful that one day she'll be able to return to work and enjoy a more active lifestyle. Every good day is a step forward, and Amber is determined to keep moving in that direction.